eye care may not be top of mind. However, for the 70 million people worldwide living with glaucoma, they risk going blind if they don't go to a doctor's office for routine procedures and visits. Dr. Tosin Smith, a specialist with Glaucoma Associates of Texas, is here to tell us more. Thank you so much for being with us.
Thank you. Thank you very much.
So let's just start out by asking, what exactly is glaucoma and what is its impact on our vision?
Glaucoma is a disease that affects 70 million people worldwide. In people who have glaucoma, they have no symptoms, but it's characterized by sort of an increase in the fluid inside the front of the eye. There's a buildup of this fluid, and that fluid is actually, the pressure in that fluid is called intraocular pressure. The intraocular pressure is the only treatable risk factor for glaucoma. So if you have glaucoma, we treat you by treating your intraocular pressure.
And tell us more about elevated IOP.
So elevated pressure is a risk factor for glaucoma. It leads to damage to the nerve and ultimately loss of vision and blindness from glaucoma. In lowering pressure, we can use medication, we can use lasers, and we can use surgical therapy. Most people with glaucoma are on medicines to control their pressure, and they sometimes struggle with that, even though this therapy is effective. They have a hard time properly and consistently using their medicines as is required to prevent vision loss.
So why do people struggle with administering the eye drops?
Well, sometimes it's hard. Many people with glaucoma tend to be older. Sometimes, the bottle, being able to see the eye drops, the tip of the bottle where to put the eye drop in. But there are various reasons why they do that. But the interesting thing, though, is that irrespective of how, they need to get the eye drops inside the eye to be able to prevent vision loss. So there's a different way of getting medication into the front of the eye that's available now. It's a new option that creates a situation where the medication is placed in the eye and it slowly releases the medicine right where it's needed, so that the pressure is then kept down to prevent some of the effects of glaucoma that we've talked about.
And are there treatment options to address elevated IOP in glaucoma?
So the treatment option, along with all the others that we talked about, but the new one is this FDA-approved implant that Allergan thought about to address some of the problems we talked about with installation of eye drops. This option is a first and only FDA-approved dissolvable implant placed in the front of the eye that helps to reduce pressure in the eye. It's slowly released over time, and it helps to lower pressure in studies up to 15 weeks. It dissolves and keeps your pressure low, and in doing that, it helps to prevent you from losing vision from glaucoma by lowering pressure. To find out more about this, you can actually go to Durysta.com. The drug is spelled Durysta.
All right, Dr. Smith, thank you so much for that information. Really appreciate you being here. And we'll be right back with more Midday Maryland right after this. Stay tuned.